Hi, I'm Dr. Atra Nair. I'm co-owner, CEO, and medical director of Midtown Medical. And we're really excited to offer this new line called Platelet-Rich Plasma and all of the services that kind of come along with it in our aesthetic world. So Christy's here with me, and so she's gonna ask me some questions because I have a lot of patients who are coming into the clinic and who have concerns or what is PRP. It's not very well known, especially in Mobile, in the aesthetic world. So you can shoot your questions, Christy.
All right, so my first question is, what are platelets?
So platelets, so our blood that we take, if you've ever had lab work done, it has a few components to it. The red blood cells carry the oxygen to your tissues. Your white blood cells are your soldiers that fight infections. Then you have platelets. Platelets are if you get a cut or if you get any kind of small nick or anything like that, they rush to that spot anywhere in your body. And they do a few things. They create a clot. They stop the bleeding, and then they release certain growth factors and certain factors that allow for rapid healing of that space and regeneration of cells. So that is why platelet-rich plasma, when we spin it down, we're spinning down your entire blood through a centrifuge, so really rapid spinning, and then we get a plasma that's super concentrated with that platelet, and then we inject it to the spots that the various things that we do, and that helps in repair and regeneration.
Okay. What kind of aftercare would I need to do?
So aftercare kind of depends on some of the procedures that we do, but for the most part, you avoid heat for about 48 hours. When we say heat, heated sauna, tub, anything that's hot. We don't want you to go and get a laser or anything that raises the temperature of that space, because these are living cells of yours and we don't want them to die.
And what about preparing for the appointment? What would I need to do to prepare?
The major thing that we need to pay attention is the quality of platelets. You're giving the product, right? And so we want to maintain the best quality of platelets. So what we really want is to stop any blood thinners. Well, for obvious reasons that these require needles, we don't want you to bleed. But also a lot of the blood thinners affect the quality and the function of platelets. So if you're on blood thinners, at least 5 days, preferably 7 days. If you can, avoid taking things like NSAIDs, like ibuprofen, naproxen, Aleve, those kind of things, aspirin, for a week. That allows your platelets to kind of get back their function. And apart from that, we want you to stop taking caffeine, preferably the day before, at least the morning off. Avoid fatty meals. The recent 2 meals that you're having, please avoid high fatty meal. If you have things like high cholesterol and things like that, that can affect the quality of platelets. So we want to make sure that you are going to your doctor, making sure that you get your annual labs and things like that. Now the other thing is, we don't want somebody who's severely anemic to come in, because we are getting your blood. It's a small amount, but we are getting your blood. And someone who has very poor platelets, so some people just have really low numbers of platelets, you wouldn't be a candidate really for this till we can get your platelet count up. But apart from this, hydration, because we are getting your blood, we want plenty of plasma, and so hydration the day prior before you go to sleep, and then on the day off. And you don't have to come in fasting. You can have a light meal. In fact, we recommend that so that you're not passing out during the procedure or anything like that. We want our patients to be comfortable.
Okay. Can I bring somebody with me to my appointment?
Absolutely. You can bring, preferably not, the entire family, but if you have a loved one that you want to be there for emotional support, absolutely, 100%. We encourage that.
Awesome. Is it painful?
So it depends on the procedure. None of them are painful because we're giving you, they all require needles. 1, we're poking you to get blood. 2, we need to introduce it. So there are needles involved. But so depending on what procedure we're getting, if you're fillers, you have local anesthetic, I actually can give some superficial lidocaine to help take that extra pain out, especially if you're super sensitive to pain. If you're getting an O shot or P shot, we actually do blocks so you don't feel anything. Some women, when they get the O shot, they can get some fullness and the feeling of pressure, but it's not pain that they feel. And we make sure we use our little tissue massager on your bones to kind of confuse your nerves so that you don't feel that extra pain. So we do everything in our power. We give you a stress ball, we'll let you watch a movie or you listen to music, whatever that makes you comfortable is what we do.
Okay. Who shouldn't get PRP? Who wouldn't be a good candidate?
So if you have active inflammatory disease, active infections, if you're getting fillers, if you have cold sores, those kind of things, you need to get treatment 48 hours before and after. Because platelets are, if there's anything wrong with your platelet numbers are low, ITP, idiopathic thrombocytopenic purpura, people don't have enough platelet count, you're not a candidate. Anything that affects your quality of platelets, they're not a good candidate.
And how soon can you see the effects after treatment?
Immediately. For fillers, so we also do fillers where we get your plasma and then we gently heat it to make it a little thicker, and then we put fillers in, and obviously that is immediately volumizing. You'll see the effects immediately. And then with all the other range of things, almost immediately, but up to 12 weeks you're continuing to see the maximum effects. I'm not saying that it lasts for 12 weeks. The effects continue to increase up to 12 weeks, and then they last thereafter. And I kind of akin it to, say you have a nick on your hand, after 3 or 4 months, you don't even see it. And that's really what PRP does. It regenerates that tissue, becomes that tissue, and it takes away that area that was nicked. So that's exactly what happens with anything that we put PRP into.